Good morning, everyone. I'm Joanne Chiwaula. I'm a nurse midwife, and I work and live in Malawi. 25 years ago, when I got my first job in development work, I saw a comic strip that was a parody of development. The first several panels showed different versions of a completely non-functional swing. And under these, it said things like, the problem as identified by the researchers, what the consultants recommended, and what was funded by donors. The last panel showed a simple tire swing, and under it said, what the community wanted. We have been aiming at that tire swing forever, but so often we miss the mark. I first went to Malawi in 2005. I gave up the idea of sitting behind a desk. I wanted to do something concrete, so I became a nurse midwife, and I found myself working in a very busy labor ward in the district hospital in Lilongwe. One day when I was in the labor ward, I stepped out just for a few moments, and when I came back to the ward, I had heard that there was a maternal death. This woman had arrived and died within a period of time that was about 20 minutes. She had done everything that she was supposed to do according to our international guidelines to keep herself and her baby safe. She had attended prenatal care. She went to a hospital for delivery and was attended by a skilled birth attendant. When she went home to her community and started feeling sick, she immediately returned to a facility to seek care. But it was the delays in the referral process within the hospital system that ultimately resulted in her death. And now she had this healthy, beautiful, newborn baby boy who was 3 days old. And I asked the midwife, what's going to happen to her baby? And the midwife simply said, the baby is going to go home with a grandmother and in 2 weeks will be dead. I was completely shocked and I thought, okay, I'm going to follow this baby. And so I did. So I bought formula. I visited them in the community. But after about 2 weeks, the baby became sick. And I helped them get admitted to the hospital. But sure enough, just as that midwife predicted, before he reached 2 months of age, he died. So on the day of the burial, I went to the community and I walked into their small village home that was filled with women. And baby Gabriel's tiny body was laid out on a grass mat. And I was overcome with a sense of shame and grief. And as I sat there crying, every woman in the room came up to me and shook my hand and said, thank you. And it was in that moment that I realized that this is a problem that was known by healthcare workers, that was known by community members, but no one was trying to address. Why else would you come to someone who has provided inadequate care and say thank you for something that resulted in a dead child? So over the next several years, that experience led to the founding of Joyful Motherhood. Today, we provide targeted family-based care to babies that are at high risk of experiencing malnutrition and dying before the age of 1. And we do this by providing nurse visits on a monthly basis, which includes growth monitoring, nutrition, health education, and a very modest business stipend. And our results have been great. Over 99% of the babies that are enrolled in our program survive early childhood. And we know from focus group discussions with guardians and community members that they view this as an impactful intervention. We hear again and again about their process of moving from desperation to hope and about the restoration of trust in the healthcare system. So we have this problem that's been known and identified by the community, and we have a really good, impactful, cost-effective solution. So now we need the funding, but we have a few challenges. So the first challenge has to do with the data. So in order to show that this problem that has been identified by the community is a significant problem, we need to find it in the data sets that already exist. So we need to look at the national data that has been compiled from districts all the way up. And then we also need to look at demographic health surveys. But this problem doesn't exist in that data. So when we talk about maternal mortality, the story ends with the mom. Nobody is following the trajectory of her baby. and we talk about child health, we don't generally distinguish between a 3-year-old and a 3-month-old, even though that 3-month-old needs breast milk to survive. The second issue is the solution itself. So when we do approach WHO and UNICEF and ask, what are the options? What are we going to do? What's the strategy for babies who don't have access to breast milk? Their answer is wet nursing. So wet nursing means that a breastfeeding mom in the community who has her own baby already takes on that high-risk infant, breastfeeds them both. This sounds like a terrific idea. Both babies are getting breast milk, which is the ideal food for all infants. Both babies survive infancy, and nobody needs to pay any money for infant nutrition. So this is terrific. But practically, what we're doing is we are conscripting the bodies and labor of women without any consideration for her health, her baby's health, or her social situation. And there's no data out there really to support wet nursing. In addition, this is an intervention that, although it happens in communities, is not something that's widely adopted. And that alone should give us pause. I'm going to tell you something shocking, but grandmothers in rural Malawian villages love their grandbabies just as fiercely as grandmothers in the US or the UK. And if there is a reasonable solution within reach, a grandmother is going to go after that solution. Grandbabies are not starving to death in the care of their grandmothers simply because they have overlooked another willing lactating mother in their own home or in a neighboring household. The third challenge has to do with the expectation of donors. So today the word is innovation. We hear this everywhere. And high-tech, low-cost solutions are platformed. And this is great. This can work well in certain situations, but our desire for innovation and high-tech has eclipsed everything else. And I will tell you that nursing care and feeding babies and health education is about as innovative as that tire swing. So after 25 years, what I've seen is that the information we're gathering from the community, we still have to filter through all the different layers of our development infrastructure before we are willing to listen and before we are ready to act. And communities, they're not asking for innovation. They're not asking for high tech. They're not even asking for high cost. They're asking for reasonable solutions to the problems around them. Communities are still asking for that tire swing. Thank you.